Hey Ford, I recently asked you about the number one best test to avoid a heart attack, but you kind of went off a tangent and talked about a bunch of tests. I just want to know what to ask my doctor, or if I can just get an order myself and get this done.
Yeah, you're not. You ask your doctor, you're not going to get the right testing usually. I mean, you'll get like maybe an A1C. At the end of the day, most doctors, as you and I both know, they're going to get an LDL, quote, bad cholesterol test, and you know where that's going. If you're not eating carbs, it can be sky high, and your doctor's going to have a conniption. That happens all the time. People are all the time coming to see us. And so the real best test gives you information on both your metabolic health, the root cause of cardiovascular inflammation, and cardiovascular inflammation. If you just test for cardiovascular inflammation, you may have the root cause going on, but not have the inflammation at this point. If you don't test for metabolic disease, you may miss both of them while you've got tissue damage happening in your arteries. So let me just give you a quick list. I mean, rather than go deeper down that logical bunny hole, let me just give you a quick list of some things to look at. HSCRP, high sensitivity C-reactive protein. It's a protein made by the liver. It's an inflammation test. It's not the be all and end all, but it's one of the best components. It should be, for most doctors that do test for inflammation, that's the test they use. Because of problems with biological false positives, I would also look at a couple of other tests. One of them is what we call LPPLA2. Another way of naming that is plaque 2. That's what we call it. It's a test that shows inflammation is usually associated with high LDL. And it doesn't mean every time your LDL is high that you have inflammation, but it's a different test for inflammation. One of the most important ones, and the one that I like the most, is microalbumin creatinine ratio. It's a test that uses both urine and blood, and it looks to see, are you having problems with the endothelium, the lining of your artery walls? If you are, you need to know that. Other doctors have used that and looked at it. They really only understand it to be a test for kidney damage. It's a lot more than that.